I'm concerned that there's lots of children who are diagnosed with ADD who really are not. I think there are children who could be treated with supplements, magnesium or iron or zinc, that probably don't need a stimulant medication. And I'm able to treat my patients with over-the-counter, more natural remedies than having to put my patients on a stimulant drug. It hurts my heart to think of all the children out there that are taking a stimulant drug unnecessarily.
Welcome to Unmasking Government Schools with Sherry Few, USPI's weekly podcast that empowers parents to reclaim their children's education from government bureaucrats and social engineers, equipping you with the tools and resources needed to join the cause.
Hi everyone, welcome to Unmasking Government Schools with Sherry Few. I'm your host for today, April Few. With me is Dr. Robert Jackson. He's been a physician in South Carolina for 45 years, and he's here with us this morning to talk about ADHD and medicating children in schools for ADHD. Before we dive in, take a moment to give us a 5-star rating, a thumbs up, and don't forget to subscribe. You can also visit uspi.org to join the movement, to get connected with your local chapter or start one of your own.
Today's episode is brought to you by U.S. parents involved in education. USPI's mission is to empower parents and local communities to break free from federal and national influences, thereby reclaiming parental authority over their children's education. For more insights from U.S. parents involved in education, connect with us at USPI on X and Facebook. To join the movement, visit uspi.org.
Welcome back to Unmasking Government Schools with Sherry Few. I'm your host today, April Few, in for Sherry, and joining us today is Dr. Robert Jackson. He has been a physician in South Carolina for 45 years. He's from Spartanburg, South Carolina. He grew up in the lower part of the state in Manning, where he began to love medicine while watching his dad minister to his patients. He graduated from Clemson University. He went to Medical University of South Carolina at Charleston. He arrived at Spartanburg for his practice residency, and he never left. He helped start the Carolina Pregnancy Center, as well as 3 other crisis pregnancy centers in South Carolina. And he's been an advocate for the unborn since the mid-1980s, for which he received the state's highest civilian award, the Order of the Palmetto, from Governor David Beasley. He's written several books based on medical experiences and ministry opportunities. I didn't know this, but Dr. Jackson and his wife hoped to be medical missionaries in Thailand, but a health problem, which was a rare form of glaucoma, prohibited that from happening. But we know everything works out for good for those who love Lord and are called according to his purposes. Dr. Jackson can be found on the web at Jackson Family Ministry. You can also hear him twice a week on his podcast, More Than Medicine. And locally here in South Carolina, he is a much sought after speaker. I actually spoke with him years ago on a panel for critical race theory. And I've heard Dr. Jackson testify in front of the South Carolina Medical Affairs Subcommittee on therapeutic intervention for COVID-19, actually. So he is amazing. Been around for a while, so he knows his stuff. So Dr. Jackson, thank you so much for joining us today. And I want to dive right in and talk about ADHD. Could you start by telling us what is ADHD?
In my medical practice, which has spanned over 40 years, I see lots and lots of children, and believe it or not, adults. There is a diagnosis for adult ADD, attention deficit disorder. Sometimes it's ADHD, attention deficit hyperactivity disorder, and that is a legitimate diagnosis. I do believe the diagnosis is overdiagnosed, and we can talk about that a little more later. What I often see, especially in children, is the inability to focus. Children who cannot sit still in class, cannot focus for very long, cannot concentrate. Oftentimes they're very impulsive and interrupt. And you've all been around children who are like that. You're trying to talk to their mom or their dad, and they're constantly interrupting the conversation. They're very intrusive children. And they cannot finish anything that they start. For example, you might ask that child to do something, and if you give them 2 assignments, they can't finish either one of them. You learn to give them one thing to do at a time if you expect them to do anything at all. But if you give that child 2 assignments, they'll never finish either one. But it's because of their inability to focus or concentrate or remember. More than that, that child cannot be still. They can't stay in a seat. They can't sit down to eat a meal. They can't sit down to watch a movie with the family. They're always in motion. They're a perpetual motion machine. They can't remember to do 2 things if you're giving them assignments, and they're always disruptive. Children with attention deficit hyperactivity disorder are disruptive children. And if you're a school teacher and you have a class of 30 children, and if you have more than 2 children in your class who have attention deficit hyperactivity disorder, then you simply cannot teach the other 28 children because you have 2 children in the class who are always in motion, always intrusive, always talking, and always moving. Now, I teach a Sunday school class that's got 15 boys in it. And 3 of the boys in my Sunday school class, I have diagnosed them without them being my patients as attention deficit hyperactivity. And I am constantly trying to tell those 3 boys to be still, be quiet, pay attention, do not disrupt. I'm trying to teach the rest of these boys the Bible, and you guys will not be quiet. You will not be still. And interestingly, their mothers will remember to give them their medication occasionally, and they'll come and sit in class and they'll be still, they'll be quiet, they'll pay attention, and they will not disrupt. But as most mothers do who have ADHD children, they do not give them their medication on the weekends. And so most Sunday mornings, those 3 boys are Tasmanian devils. And I simply cannot teach a Sunday school lesson with those 3 little boys, and they're whirling dervishes in my Sunday school class. And it's almost impossible. And I only have 15 boys in that class, but 3 of them are totally disruptive. So I feel for public school or private school teachers who have ADHD kids in their Sunday school class, well, their public or private school class, because I have terrible difficulty teaching on Sunday mornings, and I have 3 in a class of 15 boys. So there you have it.
Um, I have a 10-year-old daughter and a 5-year-old daughter. I just have girls. I have friends who have boys, and I see even the stark contrast between girls and boys and how they behave, much less, boys who have been diagnosed with ADHD. So you really hit on some good points, and I was making note. You probably saw that. But before I get to those notes, can I ask you, is there a cause for ADHD? Is there something that you could put your finger on that says this is at least correlation, maybe not causation? Can you speak to
Well,
that?
there is a genetic predisposition to ADD. And for example, in my family, I have 2 brothers who have ADD, well, ADHD, and I have 2 sons with ADHD, and I have grandchildren who have ADHD. So there's no doubt that it runs in the family. And it's interesting that when I treat children with ADD or ADHD and they suddenly become well-mannered, well-behaved, attentive children, their parents will come back to me and they'll say, Dr. Jackson, confidentially, can I ask you a question? And I'll say yes. And they'll say, I've had these same symptoms when I was in grade school, and I still have difficulty paying attention, concentrating, and finishing tasks. Can I have ADD like my child? And I say, yeah, you sure can. And they said, well, I was never diagnosed with this, but I have had terrible time with my schoolwork when I was a child. I almost flunked out of college, and I still have a terrible time as an adult on my job, finishing assignments and paying attention. Would it be possible for me to take this medicine? And I would say, yes. The answer is, of course. And then I'll put their parent, either the father or the mother, on medication, and it's life transforming for them. So the answer is yes, the medication, the diagnosis is inherited. It runs in families. And sometimes I'm treating the parent, the grandparent, and a child all in the same family. And that's the benefit of being a family doctor. You can see the generational impact. Now, the second part of the answer to your question is that sometimes vaccines are connected with ADHD. There's a lot of medical data out there now that children who've cohorts, I would put it that way, cohorts of children who have never been vaccinated have far less incidence of ADHD than children who have been vaccinated. And I would refer you to the work by Robert Kennedy and Brian Hooker, the book Vax, Unvax. And there are a lot of studies in that book that document the fact that vaccinated children have a much higher incidence of ADHD and autism for that matter. And I know that's not the main subject of today's discussion, but you asked the question, so I felt like I should at least give you a proper answer. There is a genetic predisposition, but there's also a higher incidence of ADHD in children who have been vaccinated compared to children who have not been vaccinated.
I'm so glad that you mentioned the vaccine thing, and we won't harp on this, but I'm sure maybe, increase of screen time, does that maybe have a play in that also, or is that not relevant to ADHD or ADD?
Well, children who have ADD who spend more time in front of television or video screens fare worse. It agitates them and it ramps up their symptomatology. So when I talk to parents who have children with ADD, one of the important points for them is they have to limit screen time for their children. Now, whether the screen causes their ADD, I don't know the answer to that question for certain. But I do know that more and more screen time definitely makes their symptoms worse, as does certain dyes in certain foods. There's lots of good evidence that the dyes in particularly the junk foods that children consume today can make ADD symptoms worse. So there's a lot of things that parents have to think about when their child is diagnosed with ADD. When I talk to a parent about, once their child is diagnosed with ADD, it's not a quick fix just to prescribe a medication like Ritalin or Adderall. They have to think about a rigid schedule. Children with ADD have to go to bed at the same time. They have to get up at the same time. They need a structured schedule. They also need limited exposure to cell phones, video screens, television, that sort of thing. They also need to have an elimination of red and yellow dye in their diet. All of that's very important for them. And they also need to have um, strict discipline in their home life, which is very difficult for moms who are single moms or dads who are single dads. Uh, I have an acronym called BAD. Some children are not ADD, they're BAD, which is just bad. And it's not because the child is a bad child, it's because sometimes they have bad parents and the children are not disciplined. I see lots of children in my medical practice who are very unruly and undisciplined children. And that's not the fault of the child, that's the fault of the parent.
That's right.
And sometimes it's the fault of divorce and separation. And the children are the broken pieces. And I want you to know that breaks my heart. I have lots of children in my practice who are the broken pieces of broken homes. And they're not ADD, they're BAD. And the child is not BAD, the parents are BAD. They
Right.
do not discipline their children properly. And the
Right.
children don't have structured home life. They don't have structured, or should I say, they don't have proper discipline in the home. And because of that, that child is unruly and undisciplined. And I'll get a note from their school teacher saying Johnny has ADD. And he really doesn't have ADD when I delve into it. It's just that he's unruly and undisciplined. And then I find out that he doesn't have a father figure in the home. And there's no structured discipline in the home. And it's not proper to medicate that little boy or that little girl when the issue in his life is the lack of proper discipline.
Amen. Amen. So
And
do you think, touching on this, do you think there's an overdiagnosis of ADHD, people like you just described who are BAD, but the doctors are medicating because the parents don't know what to do? I guess the doctors can't say, or maybe they can, hey, you need to discipline the child, you know? Are we having overdiagnoses because
I,
of the
I
issues you
think
just
so.
mentioned?
I think so because I receive letters from teachers and I have moms coming to see me who are desperate. And when I ask all the proper questions, I realize that the patient is not really ADD, but it's just an unruly and undisciplined child. And I have to have a real heart to heart discussion with the parent or parents. Sometimes it's grandparents. And I've often had grandparents when I suggest to them that it's not ADD, but it's an undisciplined child, the grandparents will look at me and nod vigorously and say, "You're right, Dr. Jackson. This is an undisciplined child." And if I only had them for a little while, the whole story would be entirely different because they know and acknowledge that the child is not being disciplined properly. But then sometimes, April, I have another acronym is RAM. RAM is rambunctious. Lots of little kids are just rambunctious. And I try not to treat a child before they're 8 years of age. Now, I know that hurts the heart of school teachers, but a lot of children don't even need to be in school until they're 8 years of age. And I'm not the only one that says that, but there are a lot of educators. James Dobson was very famous for saying that he didn't think children needed to go to school until they were 8 years of age,
Right.
uh, because they can learn in the third grade everything they learned in the first and second grade in a snap,
That's right.
because they just needed to learn how to relate to their peers and learn discipline between up until they were 8 years of age. And it's because children just need to be children until they're 8 years of age. And it's only the public school system that says you have to go to school up until you're 8 years of age. Where does that, where in the law, where in the Bible, where in the world
That's
does it
right.
say that a child has to go to school before they're 8 years of age? That's just totally arbitrary. And lots of little boys, especially, cannot sit still
That's right.
until they're about 8 years of age. And so, what are they labeled as? they're labeled as ADD.
That's
They're
right.
not ADD, they're just rambunctious.
That's right.
And and when you look at them in a public school setting, they can't sit still in a classroom. All they want to do is tussle and wrestle and run and jump, and they're not ready for school. They're not mature emotionally
That's right.
until they're 8 years of age. And it's just cruel and unusual punishment to make a little boy sit in a classroom when he's not emotionally ready for it. And
Amen.
so what do? They send them to me and
Yeah.
ask me to medicate them. I try not to medicate any little boy or girl before they're 8 years of age. I just don't think it's right. Now, sometimes when I look at them, I realize they really are ADD. Sometimes they're just emotionally immature. But then again, there are some children who are ADD almost from birth. And I'm serious. And their mothers are driven to distraction because their child is an attention deficit hyperactive child, and they need a little bit of medication almost from the cradle. And I'm serious about that. And doctors can diagnose those children, and their mothers need relief even before they go to school. And I've seen children who are like that. And their mothers, their parents, they need medical relief even before they're ready to go to school, because those children don't sleep at night, they don't sit still, they run, they jump, they interrupt, they intrude. And if you don't help those families, those moms will literally go nuts without a little bit of medical relief.
Mm.
And I think it is appropriate to treat those children. Now, is it overdiagnosed? I'm gonna agree that it is, and I have no doubt that overstressed teachers with 30 kids in a class, they need doctors to help them with those truly ADD children. And there's no doubt that those children need to be on a little bit of medication, because one or two kids in a class that are truly ADD need to be on a little bit of medication, or those school teachers cannot teach the other 28 children in a classroom. Teachers have a diagnostic tool that the public school and private school system provides them, and it has about 30 questions. And they'll send it home, well, send it to my office um, with all the boxes checked. And I can scan that diagnostic tool, and if the teachers answer it honestly and correctly, I can almost immediately know if a child is truly ADD or ADHD just by scanning the questionnaire. But sometimes, um, and oftentimes, the teacher is correct. And as the parent will say, uh, his dad is the same way, so is his older brother, and that genetic tendency will be corroborated when the teacher sends it to me, or when the mom brings it to me. And then what's a doctor to do uh, when a child like that comes to see me? Well, I, I often have to prescribe a little bit of medication. And of course, the two most common medicines is Adderall and Ritalin. And I usually will start a child like that, who I think is legitimately an ADD child, on a very low dose once or twice a day, and have them come back to see me in 2 weeks. And if that child is genuinely attention deficit, it will have a dramatic impact in their ability to sit still, pay attention, finish tasks, and the mom and the teacher will immediately send back a note to me, or the mom will come back and tell me that it's been a dramatic reversal in that child's ability to sit still, pay attention, and finish their assignments. Now, one of the things I really want to talk about, though, is this. What about non-medical treatment? There's a book that I want to bring to the attention of your listeners, and I'm going to show you the book. The book is called Finally Focused. Can y'all read that? Can you see that?
Yes, sir.
All right, Finally Focused. It's by a pediatric psychiatrist, and his name is James Greenblatt. Greenblatt, Greenblatt. And he has a co-author, Bill Gottlieb. And I only came across this book a year or so ago, and I wish I had known about it, April, many years ago. I think he only published it about 4 or 5 years ago, but I wish I had known about it the minute he published it, because it's been an amazing transformation in my family medicine practice. Because what he talks about are non-medical treatments for ADD and ADHD, things that I had no idea about a year and a half ago. For example, let me just give you some examples. The biggest one is treating children with magnesium. Had no idea about this. And I'll give you a personal example. One of my granddaughters was a Tasmanian devil. Couldn't sit still, couldn't stop talking, always intruding on every conversation, obnoxious as all get out. And she couldn't sit still to eat a meal. Anytime we sat down to eat, she was standing in her chair, standing beside her chair, walking around the table. And anytime she came in the house, she'd come in the front door, walk through, slug a couple of other grandchildren, wouldn't ever give me a hug or a kiss. She just totally ignored me. And then she'd walk out the back door, usually break a piece of furniture. and this the way she always was. Well, after I talked to my daughter after reading this book, she put her on magnesium as recommended by Dr. Greenblatt, and within 4 weeks, that Tasmanian devil turned into the sweetest, kindest, gentlest little granddaughter that I have.
Really?
And it was totally amazing. I couldn't believe it. And so she comes in my house now. She walks in and she sits on my lap. She puts her arms around my neck. She gives me a kiss and she sits and talks with me.
Mm.
I don't even recognize this girl. She sits down at the table when we eat a meal, and after the meal, she engages in conversation with all of us. I don't know who she is. It's a total transformation. And
Wow.
it's just a month of taking, it's called Naturally Calm. Naturally Calm. It's a magnesium product that's been around forever, and I never even knew about it.
Can I ask
And
you?
and and I'm like, well, how come I never knew about this? And he
Well, they
talks
don't
about,
teach you that in medical school, correct? You're not taught the
oh, you know
natural.
why? Because it's not a prescription and nobody makes any money off of it.
Bing, bing, bing.
That's
You got it.
exactly, the pharmaceutical companies own our medical schools.
That's right.
It's not a pharmaceutical prescription, and they don't teach anything in medical school except genuinely costly prescription items. And so there you have it. So it it it's actually magnesium glycinate,
I was going to
and you
ask that.
and you mix it with vitamin B6. The two together work really well. It's magnesium glycinate and B6. Now, Dr. Greenblatt talks about checking blood levels. He talks about taking hair samples and sending it off to be uh, measured. And honestly, I just prescribe the amounts that he recommends, and we don't really have time to go into all the amounts. I'm just recommending my patients order the book and the amounts that he recommends it, and he has a one-page conclusion to every chapter, and he tells patients and readers exactly how much to prescribe for each age group. He breaks it down into small children, adolescents, and teenagers. So every chapter, whatever he's recommending, whether it's iron or zinc or the magnesium and B6, he has the appropriate dose for small children, adolescents, and teenagers. And I'm not going to go into all the doses because it's just going to get too complicated. But the magnesium and the vitamin B6 is his first chapter. And I'm here to tell you that it can make an amazing transformation in children. Now, it doesn't happen in a minute. He tells you right up front it may take 4 to 4 weeks to up to 3 months before it makes the big difference. Now, that frustrates parents, and it especially frustrates school teachers because they want the instant fix.
Of course.
Now, what I do for some of my parents is I'll give them Adderall for a month while they're trying the magnesium and the vitamin B6. And then I'll taper them off the Adderall after about 6 weeks so that we can see if the magnesium and the B6 by itself is going to be adequate. Okay? And my parents are cool with that. They're set because truthfully, most of my parents don't really want their child on a stimulant drug.
Of course.
Most loving, caring parents do not want their child on a stimulant drug.
That's right.
And on top of that, if they are, they have to come back to see me every 3 months to get a refill because I just don't write ad infinitum prescriptions for a controlled drug. No doctor does that. And parents don't want to have to come back every 3 months, bring their child in, get them out of school, come see the doctor and get a refill for a controlled drug.
Right.
So if a over-the-counter prescription for magnesium and B6 makes their child naturally calm, they love that idea. Now, the second thing he recommends is checking a iron or ferritin level, which every doctor can do. And believe it or not, he says about a third of the children that come into his pediatric psychiatry practice actually have low iron and ferritin levels. And that once he replaces the iron and the low iron in these pediatric patients, that their ADD and hyperactivity levels ratchet down. But it doesn't happen in a minute. It takes a month to 2 months, and then those children are transformed.
Dr. Jackson, before you move on, we're going to take just a quick short break.
That's
But
fine.
you guys, when we get back, we're going to talk about more of how sleep, lifestyle, and metabolic imbalances come into play with ADHD, how to naturally help ADHD symptoms. I'll be right back with my interview with Dr. Jackson right after this.
There is no definitive biological test for ADHD, yet parents have been told for decades that their child's brain is biologically impaired and requires medication. Parents often are shamed into medicating their children under pressure from doctors and educators who claim this is necessary for their child's success. The New York Times Magazine reviewed several studies showing stimulant medications do little to improve cognitive ability or academic achievement. One 2022 study found that despite better classroom behavior, medication did not translate into improved learning outcomes. U.S. Parents Involved in Education praised that the Make America Healthy Again Commission will challenge the prevailing medical narrative and support parents who want safer choices. And we encourage parents to resist the pressure to medicate their children and carefully consider alternatives. For more information and to join our movement, visit uspie.org and connect with us at USPie on Facebook and X.
Welcome back to Unmasking Government Schools with Sherry Few. I am your host, April Few, and we're back with Dr. Robert Jackson, and he is talking with us about ADHD and how it's overdiagnosed, and he is giving us practical advice for parents on how to naturally help your child's ADHD. So, Dr. Jackson was telling us about a book by Dr. James Greenblatt called Finally Focused, which lays out natural remedies for ADHD. And he was kind of going down the list talking about nutrients. And it sounds like the first couple of things you talked about, Dr. Jackson, are what you eat, the nutrients, the
Yep.
vitamins that your bodies need. I mean, I imagine most of us in the world are deficient in something. And so you were saying that, and Dr. Greenblatt's book says getting those nutrients and vitamins really helps ADHD symptoms. If you want to continue, please telling us more about that.
Well, the next recommendation he had was what he calls nutritional lithium. Now, a lot of you recognize lithium as a medicine that we use to treat bipolar disorder, but the lithium that we prescribe for bipolar is a much larger dose, like 300 milligrams 2 or 3 times a day. What he's talking about is nutritional lithium, which is like 10 milligrams, 10, 20, or 30 milligrams compared to 300 milligrams 2 or 3 times a day. Now, some of you will recognize that there are children who are very aggressive, very irritable, and some of these are children who have ADD. And in my medical practice, I will sometimes have a parent who comes in who's terribly frustrated because they have an ADD child that's an aggressive, irritable bully. And there are bullies in schools. And some of your listeners may have a child who's a bully, who's an aggressive child, and they're unmanageable. And Dr. Greenblatt talks about children who are like that. And he says that a significant number of those children can be treated with nutritional lithium, 10, 20, or 30 milligrams of nutritional lithium. Now, it's interesting in his book, he talks about, let me just read a couple of paragraphs in his book.
Sure.
It's on page 58 in his book that I found rather interesting. Sure, I got the right page. Well, let's see. The right section, but I don't have the right page. Hang on.
And just for our listeners, while he's looking for that, the name of the book is Finally Focused by Dr. James Greenblatt, Greenblatt. He's a medical doctor. And the book, the central theme of the book is ADHD's medical condition with real underlying biological causes, not just a discipline issue or willful misbehavior, but nutrients, diet, exercise, all of the stuff that God intends for us to do helps. And so that's what the book is talking about, how to help your child naturally. Because, like Dr. Jackson said, most parents, no parent I've ever met wants their kid on any sort of stimulant because Adderall and Ritalin really are, they're stimulants and they're very
Yeah, you're
strong.
right about that.
Yeah, yes, sir.
But he gives a little history of how lithium was used medically. And he starts back in the 1920s. And he says the link between lithium and mood was so well known that a soft drink entrepreneur introduced a soda called Bib Label Lithiated Lemon Lime Soda. What a name.
Kidding me.
And it it had a slogan that promised an end to the inner pain of irritability and anger. It takes the ouch out of the grouch. That was their slogan. And the soda was soon renamed 7 Up. The 7 represented the rounded up atomic weight of the element lithium, which is 6.9. The up pointed to the soda's ability to brighten mood. Although don't look to today's 7 Up to supply lithium, in 1950s, lithium citrate was no longer an ingredient in the soda. Strange as it seems, the original 7 Up was part of an ancient medicinal tradition. People have been making use of the brain balancing power of lithium for millennia. So you see, lithium does help people to get rid of that irritability. Well, medicinal lithium is recommended by Dr. Greenblatt for children. And in the end of his chapter on nutritional lithium, he gives recommendations for children in different age brackets, from small children to adolescents to teenagers. And he talks about the graduated dosing over several months of time for children who are aggressive or irritable. And those of your listeners who have children that are like that, or even physicians who have patients who are like that, nutritional lithium can be obtained at health food stores, and it can be used to treat children who are very irritable or angry or aggressive. Well, then the next thing he recommends is low dose zinc replacement. And he talks about um, athletes. There are some children and teenagers who are very aggressive athletes. And sometimes athletes have low zinc, but some children, their diets are deficient in zinc. And because of that, it affects their mood and affects them medically, and they will have symptomatology that suggests ADD and ADHD. And he says if you're not zinking, you're not thinking. If you're not zinking, you're not thinking. And he says that 30% of his ADHD patients have low zinc. Think about that. 30% of the patients in his pediatric psychiatric practice have low zinc. And he says that if ADD meds don't work, then you need to think about low zinc. Now, I never thought about that, but I do have patients that I place on a ADD medicine, and their moms come back and say, Dr. Jackson, this medicine is not working. Well, then I'll switch them to another ADD medicine, and they'll come back and say, it's not working. Well, there's only about 5 medicines that we can try, and if none of them work, what do you do next? Well, he says you need to check their zinc level, because if nothing works, the greatest likelihood is that their zinc level is low. Well,
In your opinion, Dr. Jackson, would it be better, excuse me, to start out checking that, or is that not?
that's what I do now.
Oh,
That's
okay.
what I do now.
Nice. You were probably about to say that.
I've
Okay.
learned. Dr. Greenblatt's a good teacher.
That's
I've
awesome.
learned to
Thank
check.
you. That's
I,
wonderful.
I've
Man, I want
learned
to
to
bring
check
my kids
blood
to see
levels.
you. I
That's right.
appreciate.
I've learned to check blood levels,
That's
and
wonderful.
so uh, I've learned a lot from Dr. Greenblatt. And so, I check an iron level on these children.
That's
I
right.
check a zinc level. I check a magnesium level, and I just don't shoot in the dark now like I used to.
Right.
And I think the moms are very appreciative that I'm willing to do that, because they don't want to put their babies on a stimulant drug.
That's right.
And so, and I just think it's better medicine
Yes, sir.
than to just put every child on a medication. So I check these blood levels now before I begin treating their babies with a stimulant drug. I think
Wow.
that makes a whole lot better sense, you know?
Absolutely. Yes, absolutely. I wish we could change the whole system and every doctor think the way you think. I don't know if you heard me, but I really wish we lived closer so I could bring my children to see you. Um, We're going to take one more quick break, but don't go away. When we come back, I'm going to ask you 2 final questions to wrap up this episode. Don't go away. We'll be right back.
President Trump's Make America Healthy Again Commission, led by Robert F. Kennedy Jr., released a report in February 2025 identifying corporate influence as a major driver behind the overprescription of medications to children. The report explains that decades of overprescribing has caused unnecessary health risks and long-term damage. Corporate profits and industry marketing strategies contribute to this problem. The MAHA Commission's assessment is essential reading for parents who are concerned about their children's health. U.S. Parents Involved in Education hopes this initiative will implement bold reforms to reduce overmedication and improve pediatric health outcomes nationwide. For more information and to join our movement, visit uspie.org and connect with us at USPie on Facebook and X.
Welcome back to Unmasking Government Schools with Sherry Few. I'm your host today, April Few, who's in for Sherry, and we are back with Dr. Robert Jackson to close out this episode with 2 questions we ask all of our guests. Dr. Jackson, the first question is, what concerns you most about the ADHD and diagnosis and medication in the school system? And what gives you hope?
I think the biggest concern is overdiagnosis. I'm concerned that there's lots of children who are diagnosed with ADD who really are not. And the second thing is, after reading Dr. Greenblatt's book, is I think there are children who could be treated with magnesium or iron or zinc supplements that probably don't need a stimulant medication. And I'm so thankful that the Lord led me to Dr. Greenblatt's book. I mean, all these years of family medicine that I had no idea. And here I am in probably the last 5 or 6 years of my medical career, and I'm just now learning this. And I'm just thankful for Dr. Greenblatt's expertise, and I'm finding this out, and I'm able to treat my patients with over-the-counter, I would call it more natural remedies than having to put my patients on a stimulant drug. And it hurts my heart to think of all the children out there that are taking a stimulant drug unnecessarily. And so I've been really trying to educate some of my medical peers about the possibilities that they could treat their patients with more natural remedies than having to just slap every kid on a stimulant drug. I'm really thankful for that.
Awesome. Yeah. I think God has used you now. I mean, you say, you got 5 or 6 years left. You're just now finding out about this. And that's how I feel about a lot of things too. Like, if I had only known back then what I know now, but you are going to help countless parents who thought there was no other option but put their children on stimulant medication, stimulant drugs. So I think you're going to bring hope to a lot of parents. And so we really thank you. USPI thanks you for coming on the podcast to talk about this. And I love how open and honest you are. And I'd love to have you back on another time to talk about some other issues, because you're such a well-rounded expert. So thank you so much, Dr. Jackson, for being on the show. And for our listeners, if you found today's discussion eye-opening, please share this episode with your friends. Give us a 5-star rating, a thumbs up, and don't forget to subscribe. Also, go to uspie.org and join the movement. You'll be connected with your local chapter, or if you feel led, to start your own chapter. Thank you for your support of USPI and our efforts to unmask government schools. We'll see you next time.
U.S. Parents Involved in Education is a nonprofit coalition dedicated to restoring local control of education and parental authority. By empowering parents to reclaim responsibility for their children's learning and encouraging states to move away from federal influence, US PIE seeks to create a culture where parents are the primary decision makers in education and schools support families without the burden of federal mandates. If you want to start a state or regional US PIE chapter in your area, please visit uspie.org and complete the brief questionnaire in the chapters section.